My focus of research is really how we can use these biologic agents that are just as effective, or if not more effective, than the current chemotherapy combinations, chemoimmunotherapy combinations. How can we bring these agents to the earlier stages of disease, especially with a focus on elderly patients? So, a lot of times in blood cancers and lymphoma, which is my specialty, um, some of these regimens are called intensive because they're using combinations with a lot of chemotherapies and a lot of very intense regimens with a lot of infusions. And we now know that these drugs are almost as effective, if not more effective, than these chemotherapy combinations. So, how can we bring this to an earlier stage and start using this high effectiveness and better tolerability in patients that are not eligible for highly intensive therapies? This is my focus of research in the treatment of elderly patients with lymphoma or lymphoid malignancies using the biologic targeted agents to replace or really to improve disease control with less toxicity.